Welcome, everyone. Thank you for joining Continuous Learning with BioGuard. It is my pleasure to introduce our webinar speaker, Dr. Hongxi Chiu. Dr. Chiu graduated from National Taiwan University in Taiwan, obtaining his master's degree in veterinary pathology. He is a board-certificate veterinary pathologist in Taiwan with expertise in diagnostic pathology, surgical pathology, and lab animal pathology. Currently, Dr. Chiu works as a pathology specialist at BioGuard Corporation. As everyone knows, feline infectious peritonitis is a common illness in cats. It's an important illness in cats. FIP can be challenging to diagnose owing to the lack of pathognomonic clinical signs or laboratory changes, especially when no effusion is present. This webinar will include review of FIP and the information of each diagnostic test sensitivity, specificity, and diagnostic accuracy in FIP. Attendees might be able to realize what the result means in each test from this webinar. We are glad to have him as the speaker for this webinar. Without further ado, let's welcome Dr. Chiu.
Thank you, Robert. Can you hear my voice? Hi, Robert. I cannot share my screen. Yeah.
Yeah, okay. You cannot share your screen?
Yeah. Okay, now it's okay. Okay, thank you. Good evening. Can you see my screen and hear my voice clearly?
Yes.
Okay, thank you. Hi, everyone. I'm Chu. Thank you for joining us this evening. The topic today is diagnosis of feline infectious peritonitis, also called FIP. Okay. Please follow BioGuard on Facebook and LinkedIn. Okay. In the seminar, I will turn off my camera. And if you have any comment or question, please leave your message in the chat or message box. Okay. Okay, this is a textbook of veterinary pathology, which is a pathologic basis of veterinary disease, 7th edition. And you can see the book cover of this book is illustration of FIP. Here you can see that a cat here, and this is the virus normally stay in the intestine, and when it mutate, it will go to the blood vessels and spread into multiple organs and cause the inflammation or associated lesions. So you can see that this disease is very important, that it was used to be a book cover of the textbook. And the main reference of this presentation is from this article, which is 2022 AAFP Feline Infectious Peritonitis Diagnosis Guidelines. And you can search this article online, and I highly recommend you to read this article if you are interested. Okay, the contents of this presentation include the etiology of FIP, risk factor, transmission, pathogenesis, clinical signs, and pathology lesions, differential diagnosis, and the diagnostic tests. Okay, here's the etiology. FIP was first described as early 1960s, and even today it is not fully understood how this disease develops and spreads. Few strains of feline coronavirus vary in their ability to induce FIP. Some isolates cause FIP, or we know that is feline infectious peritonitis virus, and other cause more localized GI diseases, which is known as feline enteric coronavirus. And FIP has to be mutated from the feline enteric coronavirus. FECV and FIPB are classified as biotypes of the subspecies feline coronavirus. The genomes of FECV and FIPV biotypes are over 98% related, yet with unique host cell tropisms and pathogenicity. Normally, FECV infects mature intestinal epithelial cells, while FIPV lose the intestinal epithelial tropism and gain the ability to replicate in the monocyte and macrophages. FIP is thought to result from a mutation of the virus within the body, combined with the response of the immune system, leading to the inflammation in the multiple organ systems. And we know that feline coronavirus are fairly stable in the environment, and once dried, can survive for 4 to 6 weeks because they are enveloped virus and are destroyed by most household disinfectants. Usually, you can use the bleach at 32 times dilution. Okay, risk factors include environment with high coronavirus load, and FIP had been diagnosed in the sand litter, or immunosuppressive therapy history, or recent stressful event, including surgery, vaccination, or other diseases. And the most important is the age of 2 years old, less 2 years old, intact male, breed like Burmans, Abyssinians, Himalayans, co-infection with other disease, including FIV, FELV, or if the cat have concurrent disease, concurrent immunosuppression status, corticosteroid treatment or surgery, multi-cat household, and frequent introductions and reintroductions to new cats, variable lengths of stay in multi-cat environments, or overcrowding. All these are the risk factors for FIP infection. Susceptibility to FIP in a cat involves the interplay between virus virulence factors, host factors like genetic characteristics or age, or stressors or concurrent diseases. Okay, the transmission is primarily fecal-oral route. Ingestion of the virus is the primary route. Aerosol is also possible. Contact with an infected cat or infected saliva or feces. Because cats can shed viral particles in their faces, so sharing a litter box and mutual grooming are important sources of the transmission. Cats living in multiple cat households are at greater risk of contracting virus and develop FIP because of sharing multiple strains of the virus and stress associated with immunosuppression. Also, contaminated food or water dishes, bedding, personal clothing may also serve as a source of infection. Okay, this is the picture of the fecal-oral route transmission. Here you can see that if the cat is in a subclinical infection status, the cat will shed the virus in the feces, and when the virus, it normally has an enterocytopsin. When the mutation event occurred, it will turn to FIP, which the virus will gain the monocyte macrophage tropisms in the body. When the cat has full immune response, it will turn back into clinically healthy cat. But when the cat has only partial immune response with inappropriate antibody production or inappropriate cell-mediated immune response, it will go to effusive or non-effusive form of FIP infection. Here we can see that the green cats are less virulent coronavirus infection. Those cats will temporarily shed the virus. About 70 to 80% of cats will shed virus in the litter, or some of them are persistent or intermittent shedders, like 10 to 15%. They will shed the virus in the litter. So when the blue cats, which is susceptible to coronavirus infection, when they use the same litter, it will have the chance to develop a FIP infection, nearly about 7 to 14%. And 70 to 80% will turn back to less virulent coronavirus infection. So this is the fecal oral route in the circulation of the virus. Okay, this picture is the molecular basis of the virus infection. That we can see the less virulent coronavirus normally infected intestinal epithelial cells of the intestine. When the virus mutate, it will gain the monocyte macrophage tropisms, and the virus will infect the monocyte or macrophages. And when macrophages will go through different kind of tissues, organs, and induce variable types of infections or tissue reactions like inflammation, tissue pyrogranuloma, or pyogranulomatous vasculitis. And it returns to cat FIP-associated coronavirus infections like with or without diffusion in the body. And here we can see that the strength of the host immune response, the stronger of the immune response, the less severity of the disease. Like we can see that if the cat has a poor cell-mediated immune response, and it will tend to FIP associated with effusion. When it has a partial cell-mediated immune response, it will tend to FIP-associated coronavirus infection without effusion. Okay, clinical signs. There are two. Generally, there are two forms of clinical signs. Like the first one is wet form, which is more commonly seen in FIP infections, and the clinical signs include ascites and pleural effusion, anorexia, depression, weight loss, dehydration, or fever. In the dry form, we can see anorexia, depression, weight loss, ocular lesions, neurological signs, or enlarged internal organs, or fever. The clinical signs are non-specific. Here's three pictures of non-specific clinical signs. We can see that the cat with show lethargy, like this. And here we can see that the mildly distended of the abdomen with lethargy or weakness of the cat. And here we can see that the cat is in a depression status, weakness, And here we can see that the cat with cortical blindness as bilateral dilated pupils. Here you can see that. And here we can see that the cat has a uveitis, discoloration of the cornea. And this cat has irregular iris here. And we can see the black cat has a distended abdomen. And here we can see that the abdomen of the skin of the abdomen discoloration to dark red or red. In classic FIP infections, there's diffuse peritonitis or pruritus, which is closely by variable amounts of viscous abdominal or thoracic fluid, deposition of gray-white exudate, and disseminated necrotic plaques on the visceral and parietal peritoneum or pleura. Usually we can see that fibrinous adhesions, particularly between the liver and the diaphragm and between the loops of the intestines, can develop in prolonged cases. And in fact, when the infection goes to the CNS, it will infect the brain, spinal cord, and cause several types of masses. Yeah, here we can see that the picture of FIP infection in different kind of tissue or organs. When it goes through the CNS system, we will see seizures, neostigmas, ataxia, or vestibular signs. When it goes to the eye, we'll see uveitis. When it goes to the lungs, we will see pleural effusion. When it goes to the skin, we will see the papular lesions, erythema. When in the heart, we will see pericardial infusion. The most common thing is go to the GI tract. We will see pyodermatous lesions, vasculitis, anorexia, ascites. Okay, the lesions are primarily extraserosal, which is characterized by granulomatous inflammation in a variety of organs, but principally affect the kidneys or visceral lymph nodes, lungs, liver, eyes, and leptomeninges. And here we can see the picture of the FIP infection with effusive form. That we can see that there's a lot of fluid in the abdominal cavity. Here, like you can see that kind of an orange to yellow fluid here. And you can see that there's a fibrinous strand cover the loops of the intestines. Here you can see that all four pictures of FA infections that these cats are necropsied. You can see that like this one we see before that is fluid accumulated in the abdominal cavity. Also, there's a fibrinous strand here. And you can see that the arrow points that there's multiple white nodules cover the loops of the intestine here. Okay, you can see that the lesions covering the loops of the intestines. Okay, when the virus goes to the lungs, we can see that the severe disease, severe inflammation of the lungs. You can see that multifocal to diffuse white nodules covering the surface of the lungs and the cranial lobes that called the lobes. When it goes to the kidneys, we can see that these nodules also present on the surface of the kidneys like this. That's a randomly distributed on the surface. On cut sections, we can also see the lesions also involve the cortex, medulla here. Sorry. And on histopathology, we can see that the inflammatory cells are surrounded the vessels here. This is a lung tissue section, and in kidney tissue section, we can also see the inflammatory cells surround the vessels. And inflammatory cells are mixed type inflammatory cells, including neutrophils, macrophages, or lymphocytes. Okay, here we can see that the leftover images of is discoloration here, white and yellow. You can see that. Okay, here we can see that the discoloration of the ventricle on the histology slide. We can see that point here, that arrow here, that the inflammatory cells surrounded the vessels all around here. On higher power field, we can see that the inflammatory cells are surrounded the vessels here. In ocular infections, we can see that the discoloration of the eye, like here, white discoloration here. And this is a picture of the histopathology slide of optic nerve inflammation, and you can see that inflammatory cells involved in optic nerve. Okay. This is the differential diagnosis of FIP, that there are several conditions or diseases that we have to keep in mind in our differential diagnosis list. The first one is septic peritonitis or pleuritis. This disease often these cats are sick, depressed, and usually have fever. And septic effusions are yellow to tan in color and sometimes fuel smelling. Effusions usually contain high cell contents, and cytology usually characterized by degenerated neutrophils and intracellular bacteria. So culture may help us to differentiate. In neoplasia, lymphoma can involve multiple organs or lymph nodes. Other neoplasms are predominantly present in older cats. Here, cytology can reveal neoplastic cells. Ultrasound guide aspirates or biopsies of affected tissues may be needed for diagnosis. In toxoplasma infection, less commonly seen than FIP in cats, can involve multiple organs and cause signs such as gastrointestinal signs, ocular, pancreatic, liver, neurologic disease. Diagnosis is obtained by finding tracheozoids in the samples, or by demonstration of antibodies with high immunoglobulin IgM or rising IgG titers. In pancreatitis, you can use a FIP pancreatic lipase immunoreactivity to detect the pancreatitis. In lymphocytic cholangitis, aspirates of bile or liver and or histopathology of liver tissue sections can be diagnostic. In congestive heart failure, can lead to effusion, most commonly with a modified trenchate. Cats with congestive heart failure do not typically have a fever. Heart murmur and or gallop rhythm can be present. The cytology usually shows a very low cell count. Echocardiography can confirm the diagnosis. Mycobacterial infection will induce paragangliomatous lesions. So cytology may help us to see the acid-fast bacteria in the tissue samples, and PCR and the culture can be diagnostic. In trauma, effusion caused by trauma are usually hemorrhagic and can be differentiated from FIP effusions by cytology examination. Here we can see that you have to keep in mind that the patient history, signalment, and physical examination findings, and then selected diagnostic test and sample types based on these in order to build the index of suspicion brick by brick. So you can see that if you see the clinical signs, you take test samples, send to the lab, you do the RT-PCR, or you do the cytology, you do the histopathology, you put this brick by brick and help you diagnose FIP. In diagnostic test, we have to keep in mind that there is no simple diagnostic test. The ELISA, IFA, and virus neutralization test detect the presence of coronavirus antibodies in the cat, but this test cannot differentiate between the various strains of feline coronavirus. The only way to diagnose FIP is by biopsy or examination of tissues at necropsy with IgC. Evaluation of the cat's history, presenting symptoms, examination of fluid if it is present, and the result of supporting lab tests, including a positive coronavirus antibody titer. Okay, this table lists routine diagnostic testing for FIP against blood effusions, CSF, aqueous humor, or other. And we can see that here in the blood, CBC, the findings are non-specific. In serum biochemistry, we usually focus on age ratio. When the age ratio is less 0.4, it was slightly more likely. In effusion, usually we do revoltase test, and usually it will show positive. If negative, FIP highly unlikely. Bacterial culture usually is negative. And biochemical analysis, when age ratio less than 0.4, it will moderately more likely. And in CSF, you take the cell count or cytology or protein concentration that are all non-specific. Other like imaging examinations is usually used to locate any effusion, and also sign guided sample collection when it possible. And this is the Revolta test. A positive Revolta test result increase the suspicion of FIP, especially in a young cat, but this must be confirmed with other tests, as positive results can also occur in cats with bacterial peritonitis or lymphoma. Fluid cytology and bacterial culture can help differentiate between these causes. And this is the traditional steps of the Revolta test. And BioGuard also provide the peritonitis detection kit, which is also a Revolta test. If you're interested, you can contact us for more information. Okay, let's go to cytology. Here you can see that 6 pictures here. The first one is FIP. Usually we will see the neutrophils, lymphocytes, and macrophage, which is mixed type inflammation here. In septic peritonitis, we will see a lot of neutrophils, usually with degenerated. And in normal lymph node, we will see the major lymphocytes or lymphoblasts or plasma cells. In mast cell tumor, we will see a lot of neoplastic cells, and the mast cells has a granular cytoplasm. In lymphoma, we can see the anocytosis and karyosis of the neoplastic cells with a large nuclei. In cryptococcus infection, we will see that the organism inside macrophages. So cytology may help us to differentiate between these diseases if you take the right sample. Okay, diagnostic imaging. Usually we will use ultrasound called FAST. It's a first-line screening test that is widely used in the emergency setting for quick detection of free fluid in the abdominal cavities. It can also be used as a point of care ultrasound screening in cats susceptible of having free fluid associated with FIP. Here we can see that the free fluid here. This is the liver, and this is the diaphragm. You can see the free fluid here. Also, we can see the free fluid here among the small intestine. Also, near the kidney here. Okay. Here is the free fluid in between the small intestines. In addition to the free fluid, we can see that in enlarged lymph node here. And here is here we can see that. Let's start from this picture. That is enlarged kidney with a small ring of subcapsular fluid that may be suspected here. And here we can see there is an obvious loss of architecture in the enlarged kidney here with fluid accumulations from here. And here we can see that is the left kidney surrounded by the free fluid, which is a perirenal fluid here. Okay, histopathology. Histopathology of lesion is quite specific for a diagnosis of FIP, but sampling is invasive and can only be performed usually can be only be performed post-mortem. Pathology typically show the signs of vasculitis with perivascular necrosis. Pyrogranulopatous lesions can be identified around the vasculature, especially on serosal surfaces. An IHC scan revealed coronavirus antigen associated with macrophages within the lesions. It was recommended that biopsy be obtained from more than one organ in order to increase the odds of diagnosing FIP. And let's go into the molecular diagnosis. And in here, we can see that the detection of viral nucleic acid. There are two types of methods. The first one is direct methods. The underlying etiological agent of an infectious disease can generally be identified directly by detecting the viral genome using PCR, or in the case of coronavirus, by using real-time RT-PCR, or by detection of viral antigens or viral proteins. Indirect methods is identifying an underlying etiological agents can be done indirectly by detecting antibodies against the infectious agents. Both indirect and direct detection methods only indicate the presence of coronavirus, and not specifically the mutated virus that leads to FIP. A positive RTQ real-time PCR result with high viral loads moves FIP up the list of differential diagnosis. BioGuard also provide equipment for the real-time PCR. Okay, detection of the anti-coronavirus antibodies. Antibody testing in serum, plasma, or any other fluid is also used for the diagnosis of FIP. But antibodies are not only present in cats with FIP, but also in healthy coronavirus-infected cats or virus-infected cats with other diseases. We have to keep in mind that negative antibody test results do not rule out FIP, since up to 10% of cats with FIP do not have anti-coronavirus antibodies. And BioGuard also provide the antibody test kit here. Okay, here's the methods for direct or indirect detection of coronavirus for diagnosis of FIP against blood, effusion, and CSF aqueous humor or tissues. In blood, we use, you can see that the test list here and the sensitivity, specificity, and here we can see the common here. RT-PCR, they are not specific for FIP. Coronavirus viremia can also be detected in cats without FIP, and usually very low viral load in cats with FIP. And here we can see that S gene RT-PCR can give false positive results, not useful for confirming the diagnosis of FIP. Usually very low viral load in cats with FIP. So we have to sequencing for the S gene mutations, which is more useful than S gene RT-PCR. Controversial whether the S gene mutation are specific for FIP or only a marker for systemic spread of coronavirus. In effusion, you can use the detection of coronavirus antigen by IFA or ICC. If positive in combination with consistent routine diagnosis tests, FIP very likely. False positive result possible in cats without FIP. And you can use sequencing for S gene that more useful than S gene RT-PCR. In antibody detection, which is not specific for FIP, anti-coronavirus antibodies can also be detected in cats without FIP. In CSF, you can use the ICC RT-PCR or S-gene RT-PCR antibody detections here. In aqueous humor, you can use the ICC RT-PCR, S-gene RT-PCR. Here's the common list here. You can review it if you're interested. In tissues, you can use detection of coronavirus antigen by ICC. You can see that the sensitivity and the specificity are nearly 100%, and it is a golden standard for the diagnosis of FIP. Also, you can use ICC if positive in combination with consistent routine diagnosis tests, usually very likely. False positive results possible in cats without FIP. Usually, you can use sequencing for S-gene mutations. Regarding RT-PCR testing, RT-PCR assays involves many steps, so which can potentially introduce laboratory error. The target sequence chosen to be amplified can vary between commercial labs, which affects test interpretation. Currently available coronavirus real-time RT-PCR testing cannot definitely differentiate between the mutated and the non-mutated form of coronavirus. Both enteritic and FIP can spread. Can spread. So location-specific testing, such as this assay, may be inaccurate. Different types of coronavirus RT-PCR tests are available based on test designs. Real-time RT-PCR followed by sequencing for S-gene mutations, more specific for detection of S-gene mutations than special real-time RT-PCR detecting S-gene mutation using specific primers. So real-time RT-PCR then sequencing for S-gene is highly recommended. Okay, let's do the summary of the diagnostic testing for FIP. If the history and presenting signs are consistent with FIP and virus RNA is detected in the fluid or tissue using real-time RT-PCR, then there's a high chance that the cat has FIP. The difficulty when trying to diagnose FIP is that both the indirect and direct detection methods only indicate the presence of coronavirus and not the mutated virus that leads to FIP. Detection of mutated virus does not entirely solve the problem, as viruses containing these mutations have been found in tissues or fluids of cats without FIP. Positive qPCR result with a high viral load, if combined with consistent clinical signs and clinical pathology results, is at least very suggestive of FIP. If the cat's history and presenting clinical signs are consistent with FIP, and a virus RNA is detected in the fluid or tissue using real-time RT-PCR, then there's a significant chance that the cat has FIP. Okay, here's the key points of this presentation, that coronavirus infection, usually asymptomatic, is common in most cat populations. Because the virus is highly contagious and spreads efficiently via fecal-oral transmission, lead to a high prevalence in multi-cat environments, such as the breeding catches, shelters, and rescue facilities. The diagnosis of FIP can be challenging due to a lack of pathognomic clinical signs and lab changes, especially when no effusion is present. There's no non-invasive confirmatory test available for cats ante-mortem without effusion. Likewise, no diagnostic procedure is available to predict which virus-infected cats will eventually develop FIP. Cats with FIP typically have non-specific signs such as anorexia, lethargy, jaundice, lymphadenopathy, and weight loss. More specific clinical signs included presence of effusion, anterior uveitis, or neurological signs. There are several risk factors that have been identified for the development of FIP, including a recent stressful event noted as part of the cat's history. We have to consider patient history, segment, comprehensive physical examination findings when selecting diagnostic tests and sample types in order to build an index of subscription brick by brick. You can see that picture here. Also keep in mind that repeat examination is also important, including looking for the effusion for cytology analysis are often necessary in difficult to diagnose cases. If the cat presents with effusion, diagnosing FIP can be straightforward, as the tests using effusion generally have much higher predictive values than those using blood. The Revolta test is one such example of an easy, rapid, and expensive test on an infusion sample that has good sensitivity for excluding FIP. If the Revolta test is negative, other potential causes for the infusion are much more likely than FIP. If no effusion is present, diagnosis can become quite challenging due to the variety and the non-specificity of possible clinical signs. A good understanding of each diagnostic test sensitivity, specificity, predictive value, likelihood ratio, and the diagnostic accuracy is important when building a case for FIP. And you have to ask yourself why this test and what the results mean. When considering the PCR testing, it is important to bear in mind that one RT-PCR may not be identical to another. Prior to submitting a sample, it is recommended that clinicians contact the lab for information regarding what that particular assay is targeting to help us to guide sample selection for submission. Unlike other disease, blood samples are generally not very helpful in the diagnosis of FIP. Okay, the only way to truly confirm FIP is to detect the virus either by antigen staining or RT-PCR within the tissues. And this requires taking histopathology samples. Coronavirus antigen detection in macrophages of affected tissues via IgG is considered the gold standard for diagnosing FIP. Ultimately, the approach to diagnosing FIP must be tailored to specific presentation of the individual cat. In this presentation, we focus on diagnosis of FIP. The part of treatment and prognosis is less. In treatment, there's no known treatment that can cure FIP once clinical signs arise. Treatment with anti-inflammatory and immunosuppressive drugs with supportive care can make the cat more comfortable. In some patients, therapy may extend survival time by several months. Treatment is best advised in cats that are in good physical condition, are still eating, have no neurological signs, and do not have concurrent FELV-induced malignancy or bone marrow suppression. The treatment is directed toward controlling the immune-mediated vasculitis and reducing viral load. The most effective treatments are combinations of prednisolone and cyclophosphamide. Supportive therapy for FIP is important and includes using antibiotics and nutrition and fluid intake. The use of low dose of aspirin because they can be useful as an anti-inflammatory effect. In prognosis, the likelihood of survival is very poor for cats who are clinically diagnosed with FIP, usually 1 to 1.5 years. With a 95% mortality rate, euthanasia is normally the best appropriate course of action. In prevention, an intranasal MLV vaccine to prevent FIP is available, but has shown very little effectiveness. And we have to reduce the exposure to the disease, such as disposing of feces properly, early weaning, isolation of cats that test positive for coronavirus antibodies, proper sanitation, cleaning with disinfectants, immunization against other feline viruses. Okay, the last two pictures are the diagnostic workup of FIP when the FIP case is suspected. You can see that effusion sample cytology and biochemistry consistent with FIP, you can do the RT-PCR or IHC for coronavirus antigen. Either positive, you can see that the FIP is very likely. When the test is negative, it returns that the FIP is less likely. If still suspicious of FIP, you can take the FNA samples from the organs, then using the RT-PCR or IHC for antigen detections. When the results are negative, you have to look for causes other than FIP, or you have to do laparoscopy, or TrueCut to take biopsy samples for histopathology detection and IHC staining. When the histopathology results consistent with FIP and IHC result is positive, then the FIP is confirmed. When the histopathology tests and IHC tests are negative, that FIP are unlikely. In the case of absence of effusion and present of non-specific clinical signs, you can perform the diagnostic imaging. Then you can take the FNA samples from the abnormal organ or tissues. You can do the RT-PCR and IHC for coronavirus antigens. When the test is positive, then FIP very likely. When the tests are negative, then the FIP unlikely. If you are still suspicious of FIP, you can continue monitoring as the abnormal can develop over time. And then you can take the FNA sample or TrueCut or biopsy sample for histopathology examination or IHC stain and RT-PCR. When the histopathology results are consistent with FIP, then we can confirm the FIP infection. In neurological findings consistent with FIP, you can take the CSF samples for analysis. You can do the ICC. When the test is positive, and FIP very likely. When the test is negative, the result is the FIP is unlikely. If you still suspicious of FIP, you can continue monitoring for the neurological changes. And you can use imaging examination to take the TrueCut FNA or biopsy samples for histopathology examination or RT-PCR. In ocular lesions, you can take the aqueous humor, which is the fluid in the eye, for cytology examinations. Then you can use you can do the ICC or RT-PCR. If the tests are negative, FIP unlikely. If you still suspicious of FIP, you can continue monitoring for the ocular changes. If enucleation is performed due to severe conditions, you can submit the eye for histopathology examination for FIP. If the histopathology results are consistent with the FIP and IHC result also positive, then we can confirm FIP infection. Okay, this is the end of presentation, and I really thank you for attending this meeting. Thank you for participating and follow us on Facebook and LinkedIn. See is there any question here? And the first question here is, how do you convince a client that an FIP case is an FIP case if the coronavirus test is negative? I'm not quite sure about these questions. The coronavirus test negative, what kind of test is RT-PCR or antibody or Revolta test? When the if the test you use is negative, but you still suspicious with FIP, you can convince your client to take different kind of samples or monitoring the patient's conditions and come back to the clinic a few days or few weeks later, then take the sample for an analysis. Because we know that the disease will is not is a some case will prolong in long term. Like so I probably will recommend my client to take the samples through TrueCut or take fresh sample to RT-PCR examinations or histopathology examinations. And the second question is, how long does coronavirus stay in the infected cats, and how long should we worry about mutation? I cannot answer these questions because the studies is ongoing against the virus, and there we don't know that the mutation how the frequency of mutation. The third question is, in a country where PCR is almost out of reach, which diagnosis test do you prefer in a non-diffusive form? In in the non-diffusive form, I will do um, TrueCut to take sample for histopathology examination and IHC stain if it is applicable. What do you think about the GS 441? Okay, this kind of drug is usually not available in many countries, and it is a black market drug. So we don't use this drug. I have no experience in using this drug because it might be have lethal, have some kind of issues. So I don't have the experience of using these drugs. What antibiotic would you use in FIP positive cats with clinical signs? I will use broad spectrum antibiotics. Okay, here's the same question again. What's your opinion with the use of new drug GS? I think this drug is only for research purpose, that is not going to the market. But I know this kind of drugs in use in some countries, but no, I have no experience of using these drugs. Is the mutated form of virus infectious as FIP for other cats? Is the mutated form of Sorry, Dr. Pedro, I don't understand your questions. The treatment we use now is prednisolone and cyclophosphamide to induce immunosuppressive effect. So the drugs in the black market that I have no experience of using these drugs. Okay, do you have any other comments or questions?
Okay, if there's no any other questions, then we'll thank Dr. Cho for today's presentation. It's a very excellent presentation, and thank you for all of you attending this webinar. And we hope to see you again in our next webinar. Thank you. Bye.